Hello, this is Alex Vasquez. What I'd like to do in this brief presentation is introduce you to my latest book, published in 2012, called Migraine Headaches, Hypothyroidism, and Fibromyalgia, Assessments and Therapeutic Approaches Using Integrative Chiropractic, Naturopathic, Osteopathic, and Functional Medicine. This book is available on my website, optimalhealthresearch.com. It's also available through amazon.com. This book is 280 pages, and that's 5 chapters of clinically oriented information and treatment protocols. Chapter 1 is Introduction, Patient Assessments, Concepts, Musculoskeletal Emergencies, and Healthcare Paradigms. Chapter 2 is Reestablishing the Foundation for Health. That's a naturopathic concept about just healthy living and how to create an environment where people can actually be healthy. Chapter 3 is on headaches and migraine, of course, and Chapter 4 is on hypothyroidism, and Chapter 5 discusses fibromyalgia. With regard to fibromyalgia, I think what we all know, for those of us who study this, we all appreciate that it is a somewhat common condition, about 2 to 3% of the U.S. population. That still comes out to several million people, mostly women, below the age of 50. And we know that it's associated with chronic pain and other systemic problems too, like fatigue, gastrointestinal disturbances. Migraine headaches are very common among people who have fibromyalgia, as is chronic low back pain. We also know that it's associated with some biochemical abnormalities, such as tryptophan deficiency as measured by tryptophan levels in the blood. We know that these patients have increased evidence of increased oxidative stress. We also know that a large percentage of them have bacterial overgrowth of the small bowel, and they also have antioxidant depletion, which more specifically recently has been shown to be associated with mitochondrial destruction, basically. There's a term that we'll look at on the next slide called mitophagy. What that basically means is consumption or destruction of the mitochondria, which are the energy-producing organelles of the cell. So the association there with the global picture of fibromyalgia is that these patients are under oxidative stress, they have multiple nutritional deficiencies. This leads to mitochondrial impairment, and once the mitochondria, that is the energy-producing organelle of the cell, once those mitochondria are impaired sufficiently, they actually undergo a destructive process called mitophagy, and of course that contributes to the ongoing fatigue and pain that these patients have. If we look briefly at one of these diagrams that I've put in the book, we can see that in the upper left-hand corner, the disease is promoted and really caused by bacterial overgrowth of the small bowel. That leads to all the problems that we see in patients with fibromyalgia, whether it's tryptophan deficiency leading to serotonin deficiency, which causes food cravings and anxiety, depression, and just overall pain sensation, because serotonin, which is derived from tryptophan, is a neurotransmitter that helps alleviate pain. So when patients don't have enough serotonin, because in this case they don't have enough tryptophan, because the tryptophan is being destroyed in their gastrointestinal tract by the bacteria, that leads to this syndrome of chronic pain, along with some of the psychosocial considerations like depression and anxiety. When patients are deficient in tryptophan and serotonin, they're also usually deficient in melatonin. Melatonin helps promote sleep, and it also helps protect the mitochondria because it acts as a mitochondrial antioxidant. So as you can see in this chart, and of course you can stop the video and take a look at this chart in more detail if you need to, but you can see that a lot of the abnormal or biochemical abnormalities seen in this condition lead to mitochondrial impairment, and once that process begins, it is kind of a vicious cycle where mitochondrial impairment leads to oxidative stress leads to antioxidant depletion leads to more mitochondrial dysfunction, and eventually it leads to destruction of the mitochondria, which has been documented in patients who have fibromyalgia. If you look at muscle biopsy samples from these patients, they do show increased oxidative stress, muscle damage, and reduced number of mitochondria. So part of what I describe in the book is how to reverse that process, or at least stop it from progressing, because mitochondrial death, of course, is not something that is associated with wellness and feeling good. In fact, it's associated with the opposite. As these patients continue to lose mitochondria, they become progressively debilitated and more and more difficult to treat. So we need to intervene early and prevent that mitochondrial demise so that we can help these patients get better faster. So again, the name of the book is Migraine Headaches, Hypothyroidism, and Fibromyalgia, Assessments and Therapeutic Approaches Using Integrative Chiropractic, Naturopathic, Osteopathic, and Functional Medicine. The book is, as most of my books are, the books are more or less written mostly for doctors and medical students, healthcare students. But I think the information in here is more or less accessible and readable for everyone. And I am trying to make this information available so that patients with these conditions, migraine headaches, hypothyroidism, fibromyalgia, these are all common conditions. They're often unsatisfactorily treated by the standard medical approach. And so I'm just trying to make this information available. The book only costs $25. It's 280 pages. It's available from Amazon.com, and it's directly available from CreateSpace.com. And I've given you the book number there on the screen. CreateSpace.com is a subsidiary owned by Amazon.com, so it's their publishing arm, basically. So if you want to order it directly from them, you've got the CreateSpace internet address right there. So good luck. Thank you for your attention with this, and hope this information is beneficial for you. Take care. Bye.